actually have a picture of what melanoma will actually look like if we see it in a patient. So this is something here. Can one of you just kind of describe what we're looking at? And I know, like, my dermatologist has told me about these factors before, but if you could explain them to our viewers.
Absolutely. So this is a great slide, is what we call the ABCD, and you know, even E has been added onto that as well, of melanomas. So what you're seeing here is a pigmented lesion. Everybody has pigmented lesions on their body, but really melanomas a changing pigmented lesion. And what you're looking at is asymmetry. You can see that this is not a perfect circle or a perfect oval. It has very asymmetric borders, and B is the border. Notice that the color change on the border, it's different than the central part of the lesion. C leading into color, obviously, the darker color. And different forms of pigment around a lesion are concerning. And D is diameter. So the wider it gets, the more concerning the lesion gets. And if it's growing or extending, that's a problem as well. And I think there's also a new D, and that's dermoscopy. A lot of dermatologists are trained in a special skill of using a special lens to look at these lesions, and they can better characterize them before a biopsy as to how suspicious they are, if they can be watched, or if they should be biopsied.
Okay, now, again, I see my dermatologist on an annual basis. Is that what you'd recommend for people as far as getting moles checked, or is there a different time frame that might actually be better?
So I think that for the general population, that's reasonable, but people with history of other skin cancers and melanomas may need more increased surveillance. Okay. People with genetic conditions, as we just spoke about, or strong family histories may also need more increased surveillance.